wonderful patient, Doc. He is what we call a surgical keratoconus. He had LASIK surgery. How many years ago?
Close to 15.
And this was up in Georgia, right? And more tissue was taken away than needed, so he's landed with ectasia. The whole cornea is bulging.
Okay.
And it is scarred, so it's got blindness.
Forward and scarred.
Poor thing. And only option he's been given is?
Transplants.
There you go. So our fight is how can we try and avoid that in a young man. And if you look at his eye trace here, you can even see the stigmatism, 74 diopters. Can you see that?
That's
74.
Very significant.
Got it?
Yeah.
So his doctors are not wrong in doing a transplant, but can we fight and do corneoplastic based ring surgery on him, okay?
Right.
Excited? Let's go.
Very.
Wonderful. You see that area, we are clearing the LASIK area and going below that in this ectasia case. You can now see the incision come up at the real planned axis of 160. Right there. See in this case, severe ectasia, over 74 diopters of irregular stigmatism with scarring. You can see the LASIK flap here all the way. Many years ago in this young gentleman who's traveled to us, and we just with the femto laser made channels underneath that LASIK area but very close to the flap, and we're going to plan to do a corneoplastic based intact surgery. Are you comfortable? Very good. See that? You can see the rings have been inserted now at this axis, and now I'm going to go after the scar area and the ectasia portion. So we are now applying mitomycin to the area of scar that we cleared on his LASIK flaps. We're being very careful. We made the channel under his LASIK area. So now we have the LASIK flap here, and I've removed the scar off the LASIK flap, and now I'm using mitomycin straight on to help that area heal without any further scarring. Any pain at all? Wonderful. Fascinating. Don't move. Look at that, Mom. See the rings. See the full scar, how we remove the top portion of the scar. Look here, please, Tony. Look at me straight. Look at that. Ready, Rasha? So here's a wonderful gentleman. He's traveled all the way. He had LASIK surgery with his doctors and left with very high ectasia, a bulge of over 74 diopters, irregular stigmatism, right? With central scar, and we've done a corneoplastic based intact technique. Also, we removed the top portions of the scar optically, which is important, and we had to do all this on his LASIK flap without touching the LASIK area. If you can see the imaging now, there he is. You can see the rings placed with the G intact technique. The scar reduced, no stitches at all. And I always ask the patient, any pain? Mom, what do you think?
I think that looked fantastic.
Very nice. Super.
I figured out when I did my
Tony,
exam, so
I do so many of those guys, I'm telling you. But what I loved is how you said it. I love to inspire doctors. So we'll repeat all this. So the guys are leaving Virginia?
yeah. I didn't tell you that I played in the NFL, and I appreciate what you did for me. The doctors in the NFL didn't tell me this, and for me coming to you and you finding out, I really appreciate it. So I'm gonna send you a call. I wish I had a jersey I could send you, but
Oh, you guys are my gifts. Just have a pleasure. Careful.